Tune in to NCN on Thursdays at 7 p.m. and the VOG on Fridays at 11 a.m. for the Ministry of Health's weekly program, Health Matters. This program seeks to educate you, the general public, on proper health-seeking behaviors while making you aware of the services available at the hospitals and various health facilities across the 10 administrative regions. You don't want to miss this. Tune in on Thursdays and Fridays. Be educated, be informed, because your health matters. Hello and welcome to another edition of Health Matters, a presentation of the Ministry of Health. And on today's program, I'm pleased to have the Honorable Dr. Frank Anthony, Minister of Health, and he will be walking us through the period of this year, 2021, of the achievements of the ministry. Welcome to our program, Dr. Anthony. Obviously, what would have taken up as much of your time and we would have seen in the media is COVID. No doubt you want to start with that. Tell us about your COVID story for 2021.
Well, first of all, thank you for having me on the program. COVID, it's something that the whole world is battling with. And I think a lot of health ministries globally, we're kind of consumed by COVID. But in Guyana, we have worked very hard to bring the pandemic under control. And one of the tools that we had at our disposal during this year is really vaccines. So we've started doing vaccination from the 11th of February this year. We started out with our healthcare workers when we got our first set of vaccines. After that, we were able to expand that program to cover persons with comorbidities. And eventually, we were able to get it to a wider part of our population, meaning persons 12 years and older. So right now, we are doing vaccinations for anybody 12 years and older. And so far, our results have been relatively good. We have been able to get, for first dose coverage, for adults, about 79.9% of our population getting a first dose, and about 59% second dose. So that's not too bad. And we have been working steadily to increase the coverage between 12 to 17. So in terms of vaccination, we are doing relatively well. But with Omicron, the dynamics are changing. And even if you're vaccinated, it is recommended that you go and get a booster shot. So those persons who've had their last dose, say 6 months ago, you will really need to go and get a booster shot. We have been offering booster shot for about 3 weeks now, and as of today, we've had about 10,076 persons who would have received their booster shot, and we want more people to come out and get it. The thing is that if people are not vaccinated, they would have a more severe form of COVID. And of course, some of those persons who come into our hospitals would probably die from COVID. We can prevent this with vaccination, and that's why we keep emphasizing that people should get vaccinated.
I'm surprised by the numbers, even though it might not be to your liking, the amount of people who are already turning up to be tested.
Well, in terms of testing, we have been seeing people coming. We would like more people to come, because if more people come, we'll get a better sense of what is happening with the pandemic in the country. But we have to keep trying. We have testing sites nationally. We have in all our regional hospitals. We have granted permission to a number of private hospitals for them to do testing, private laboratories. So there's a wide range of institutions that are offering both PCR and antigen testing. Therefore, there's no excuse if anyone has been exposed for them to go and get tested.
The Lilliandale Complex there is up and running. Maybe tell us a bit about the achievements there.
Well, we have, when we took over, that place was not operational, and we had to connect water and electricity and everything else. And of course, it had no equipment. But despite taking over it in that state on the 5th of August, we were able to put our first patient in that hospital by September, mid-September. And we have steadily increased capacity there. So we have right now 195 beds in the facility, and we have a capacity for 52 patients in the ICU. So we have expanded the ICU from being a 7-bed ICU to one where we have capacity for 52 beds right now. So that has come along, a far way. We are able to do X-rays there. We have put in an operation theater. So persons requiring minor surgery, and if they're COVID positive, the operations are done at the Ocean View facility. Pregnant women who are COVID positive can deliver at the facility. So we have done a number of things there. And for patients who require dialysis, we can do dialysis right at the center as well. So these are things that we have been able to install over the last year, and to make sure that we are offering a wider range of service at the facility.
I know the COVID task force has a lot of work to do, but are you comfortable with the work done on the borders as we look at other countries trying to do lockdowns and lockouts? Our borders doing well.
Look, we have to draw a balance, because if we institute all the stringent public health measures, it would basically mean we're shutting down economic activity. Mm-hmm. So on one hand, we can prevent the spread of the virus, but on the other, people would have severe economic challenges. So we have tried to get a balance, and that's not hard to reach. And I think the experiences of many countries that have gone to lockdown, with this Omicron wave that we're seeing now in Europe and other parts of the world, countries are struggling as to whether to go back, revert to lockdown, or others are saying they cannot afford it. And therefore, they too are seeking that balance. So it's something that all countries would struggle with, because we have seen the economic impact that it has had. And therefore, we have to get that balance. Now, to maintain that balance, people need to behave responsibly. And therefore, you have to get vaccinated, avoid crowded places, do the sanitizing, wear your mask, especially if you're in a crowded environment. And with Omicron, you have to get one of these surgical, or I would say the N95 masks, because they would be better at protecting you from the Omicron variant.
Dr. Anthony, other areas in the health sector has also had you quite busy for the year. And of course, we just saw on social media that you even have a boat being launched somewhere. So there's still tons of work to be done in other areas of the health sector, in other infectious diseases. Tell us about those areas.
Well, we continue the regular work of the ministry. Despite COVID, we have to do all the other things that the ministry has been doing on a routine basis. So malaria has been one of the areas that we keep focusing on, especially in the interior areas where it's endemic. So regions 1, 9, 7, 8, parts of 10, we still have lots of cases of malaria. So we had a program early in the year where we have been giving out bed nets. These are special bed nets because they're impregnated with insecticides, so they last for about 3 years. And if a mosquito touches the net, then they come in contact with the insecticide and they would die. So that's one way of controlling the mosquito population and reducing the cases of malaria. For this year, we have distributed about 58,000 bed nets in these various regions, and we think that it's going to have an impact on the cases of malaria that we'll see, not only for this year, but going forward. Apart from malaria, we have also this year completed the mass drug administration for filaria. And now we're in an assessment period where PAHO WHO is now doing an assessment to see what's the level of the parasite in the general population. We are hopeful because we would have done about 72% of our population receiving the meds for filaria. And therefore, we will be closer to eliminating filaria as a disease from Guyana. This is one of the WHO's neglected diseases, and we really want to see this eliminated from Guyana by 2025. And the results so far has been optimistic, and therefore I think we are on target for that, to eliminate this disease from Guyana. We have also been working in HIV. As you know, there have been lots of innovations in the area of HIV, new meds, new ways of testing, new ways of prevention. We have been relatively slow in the past to adopt some of these things. And we, over the last year or so, this government have decided that we need to embrace these new techniques to make sure that we can reduce not just the spread of HIV, but to prevent HIV. So we have introduced comprehensive PrEP. That's pre-exposure prophylaxis, where we are able to give at our HIV clinics medicines that can prevent people who would normally be at risk for HIV from getting HIV. So that program is in place. We have also started to pilot self-testing. This is something that has been happening in the United States since 2010. We are only now adopting that. And so, but it's another way of people knowing their status. And once they know the status, they can take the relevant measures. So this is something that we have introduced. And once the pilot is completed, we'll want to roll that out on a larger scale. We have also been right now doing the BBSS. So that by early next year, we should have the results of that. So we'll get a better picture of what is happening with HIV in the country. And of course, in terms of medication, we have been working to provide antiretrovirals to our patients. You know, Guyana is one of the few countries in the region that would have achieved, the UN would have set a target of 90 in 1990. And now that has changed to 95, 95, 95 by 2025. In terms of the first 90, which deals with knowing your status, we are actually at 94.6%. So we are almost there in terms of completing the first 90, knowing your status. And this is a target that we have to achieve by 2025. So I think we're pretty much on track. Mm-hmm. And those who know their status, if they're positive, to make sure that they're on treatment. So we are working to improve those numbers. And those who are on treatment, to have them virally controlled, we are also working on those numbers. So HIV, it's another one of the diseases that we've paid a lot of attention to, because we have approximately about 9,000 persons who are positive in the country, and therefore we have to provide care for them. TB, which has been another one of the infectious diseases that we have been working on. We haven't seen many new cases of TB this year, but nevertheless, those persons who would have presented with TB before, we are ensuring that they can take their meds. You know, with the TB program, we have introduced DOTS many years ago, where people had to be physically there to see whether or not the person is taking their medication. We have introduced a new concept now called video dots. So you do it with a smartphone, so the healthcare worker can see whether or not you're taking your meds. So these are all innovations in the times of COVID that we're using.
Virtual medicine, kind of.
Virtual medicine. So infectious diseases, we are
And you still
working
have-
on the
you still have
traditional
some work,
ones.
you do some work with other STIs also.
STIs, we've been working on that to reduce the burden there. And next year, we have put into our budget to get the funds so that we can do elimination of Hep C. There are medications now that are available that if patients use them, they would be able to eliminate Hep C. Hepatitis C, if not treated, can lead to cancer of the liver. And therefore, we really want to eliminate this. On an annual basis, we probably see 120, 25 cases. So here is an opportunity that when we find these patients, we can actually treat them and cure them of Hep C. So that program will start from next year.
Chronic diseases always been and always will be a little bugbear.
So chronic diseases, things like cardiovascular diseases, diabetes, and so forth. We're designing programs to reduce the burden of all of them. We have been working over the last year with PAHO. We have a program called HEARTS. And this program is designed to reduce the risk factors for many of the chronic diseases. So we look at moderating people's high blood pressure, measurement, checking it, making sure that we can bring that under control, exercise, looking at what they eat, their nutrition, reducing of trans fats in their diet, and so forth. So we have piloted this HEARTS program, and we're expected that next year we'll roll it out to many more sites so that we can reduce the burden of these diseases. In terms of diabetes, which we estimate we have about 60,000 or so patients, some of them don't know that they even have diabetes, that we have to design a more comprehensive program to address this. Testing, making sure that those who have tested for diabetes, that we're able to control their blood sugar. We have to do more nutrition counseling and teach people how to eat, what to eat, when to eat. We also have to teach them to recognize the complications of diabetes and the reason why they need to keep their blood sugar in the normal range, because these complications can lead to blindness. Some of it can lead to loss of sensation in your legs and so forth, which then leads to other complications such as ulcers and things like that. So we have right now a project that is near completion, a building that is near completion. This would be a pilot site for comprehensive diabetic care. The building is at Luziknan, and the intention here is that when a patient with diabetes comes to that facility, you'll have doctors who would work with them. The doctors then can send them in the room next door for nutrition counseling. We'll have persons there who are trained to do nutrition counseling. We also would have labs that are available, so all the blood tests can be done right there. We have eye screening that would be done right there. And for persons who would require specialized shoes, so as to take off the weight and prevent ulcer formation and so forth, we'll have the rehab department having another unit there to make sure that they can make these shoes and so available. So Basically, what this would be is a one-stop shop for diabetes care. So everything relating to diabetes, when you come to this facility, you will be able to get it. So we are testing that concept. It has worked in other countries. In Brazil, they have such a center. In Haiti, in India, and it has worked well in these settings. So we are testing that concept here, and if it works well, we'll replicate it to some of the other regions.
Thanks, Dr. Anthony. We'll take another break, and when we come back, we'll have more for you on health matters. We've got Dr. Anthony giving us a review of the year.
My name is Danica Camera. I'm from Festival City. Coming to this clinic, well, when I joined the clinic, I didn't know much about the clinic, but learning from the doctors, it helped me a lot during my pregnancy. And it's been so grateful to me during trying this pregnancy. I feel a lot because the doctors them here are very good and they teach you a lot about certain things. So I feel much better now coming to this clinic, and it helped me a lot because I'm living right close by to the clinic.
My name is Tia Damon. This New Health Center is a really good initiative because it's really close to me, and it actually saves me time from having to go till the GPHC and wait amongst a whole set of people. I'll be coming here more often. And also the COVID site is really convenient because you don't have to go till downtown to get your vaccine and stuff like that.
This is the first time I'm attending here, and it was great for my daughter to get her vaccine.
I'm glad this health center is here so I could get my vaccine easily.
Welcome back. Dr. Anthony, COVID would have got you quite busy, but yet we've seen you traversing Guyana, actually putting on gloves and doing actual work and to upgrade certain places, health centers and hospitals. Guide us through those achievements.
So in every region, we actually did a lot of infrastructural work. So if you start with Region 1, we have been doing work there at the Mabaruma Hospital. We want to make that hospital into a smart hospital. This is a partnership that we've had with the UK government, where they have selected 5 sites to upgrade these facilities to make them into smart hospitals. So we've received the funding from them. And Mabaruma is one of the sites that we've been working on. We are hoping that we'll complete all the refurbishment by the end of this month, so that hospital would all the services would reopen in the first quarter of next year. So what are some of the things that we've done there? It includes the accident and emergency. You would have a new accident and emergency there. Theaters, ICU, recovery spaces, MCH. A new kitchen was built. We have repurposed the pharmacy. So a lot of work has gone into that. And in addition to kind of having a better flow of the hospital, we have also put in solar panels so that our consumption of electricity can decrease and we don't depend solely on the power that is generated, but we can also use solar. And we have been capturing rainwater and repurposing that for activities within the hospital. So we're also climate resilient in a sense, preventing flooding and those types of things, and making sure that we can utilize solar power. So that's Mabaruma. At Port Kaituma, we have installed an X-ray recently during the year. So they now can do X-rays at the hospital for the first time. At the Kumaka Hospital, we have added a new theater, ICU, recovery room. So for the first time now, the hospital would have capabilities of doing minor operations. We have also been refurbishing health centers and health posts. We have completed the refurbishment of Waramuri Health Center. We have also fully refurbished Arukumai Health Post, Blackwater Health Post. In Region 2, we have done a number of refurbishment, including building a new unit where we can do infectious disease types of work at the Saudi Hospital. We have an isolation unit at Saudi Hospital for COVID-19 patients, And many of the health centers that we had in Region 2, we have done refurbishment works on them. In Region 3, our flagship program there for this year has been the Lenora Hospital. That's nearing completion. That would be reopened in the first quarter of next year. And again, we have added a lot of capacity, including theater capacity and so forth at that hospital. We have also repaired a number of health centers, and we have added a blood bank for the first time in Region 3. In addition to that, for next year, we have slated some major works in that region as well to enhance hospital facility in the region. Region 4, we've recently commissioned the Diamond Hospital, and a couple months ago, about a month ago, we have commissioned the Supply Health Center, and before that, we also did the Better Hope Health Center. These are all new health centers in a sense, because the extent of the work that was done was major works, and therefore you can almost consider it as a new facility. So Region 4, we have done that type of work. In Georgetown itself, under the ministry, there are about 10 health centers that we've looked at, and we have done refurbishments to them. We have spent a lot of money on the Festival City Polyclinic. That has now been reopened, and it's under the management of the Georgetown Hospital. So the residents of Festival City and surrounding areas now can benefit from a modern facility, which would include not just for doctors that would do primary health care, but also dentists and rehab specialists and a number of other specialities that would be working out of that facility. And at Enmore, we were able to put in a X-ray so that persons coming to the polyclinic at Enmore can now get X-rays right on site. In Region 5, we did a lot of work on the Maikoni Hospital, fixing the accident and emergency of that hospital, fixing up the theaters. And so now we have the capacity to do surgery at the hospital. We have also fully refurbished the health center at number 7. And there were some other minor works that were done at other facilities. Region 6, New Amsterdam, we did a lot of work in that hospital. We are now finishing off work in the maternity unit. And there are some other sections of the hospital where we did work. In the Fort Kanji Hospital, we did the whole kitchen back. We had to, after the fire, we had to do back one of the chalets there. Those works are completed. We have done refurbishment works at Port Morant, Maibikuri, and at Skeldon. So lots of work happening. In Bartica, we have put in the apartments for persons, healthcare workers that would go up there to work. And we have also done work at Kumaka Hospital to make sure that we can have theater capacity. Similarly, in Regions 9, we have done work at Lethem, Aishalton, Karasabai, extending the services that we can offer there. At Lethem is another one of our smart hospitals, where we have improved the theater space, the recovery room, pharmacy, inpatient facilities. We have also added a maternal waiting home in Region 9, so that mothers who need to deliver their babies, they come a few days earlier, they wait in the compound of the hospital, and when they're ready, they can come into the hospital. So that's a new facility that we have developed. And we have a number of other waiting homes that we're doing in these interior locations. So that would help to ensure that we have safer childbirth, decrease the amount of mortality that normally would happen in these interior locations. Region 10, we have done works at the Linden Hospital Complex. We have opened a new health center at Bamia. We have done some work in Kokwani. So again, basically in every region, we have done lots of work in terms of the infrastructure.
Dr. Anthony, but I know you're big on training and collaboration. Quickly run us through that.
So training we have in different levels. For the interior location, we have expanded the community health workers training. So we have graduated about 70 community health workers in Region 1. These persons are going to work in almost every village in Region 1. Region 9, we did a similar training where we graduated about 6 to 9 or so persons. And again, they'll be going back to each of the villages, Region 7, Region 8, similar types of training. This year, we started a batch of MedXs, about 41 of them. And when they complete their training, after 3 years, they'll be going back into these communities to take up the job offer of working as a MedX in these areas. Next year, we're planning some training for pharmacy aid, laboratory aid, so it will supplement the services that we're offering in these interior locations. Nursing training, we are going to improve that, so we're going to expand the intake of nursing students. And we are also working on a collaboration to improve nursing education in Guyana. So we'll roll those programs out next year. We have also done some collaboration with a number of institutions. So with Northwell, for example, we have now observerships that would be done in the hospitals in New York. Northwell has 22 hospitals, so we have spaces where we can send doctors for training up at Northwell. We have a similar arrangement with McMaster's, where we can send doctors up to Canada to do a 3-year specialty training in Canada. And when they come back, they'll work as specialists in Guyana. We also have a similar arrangement with UWI, where we can send persons for training at UWI in various specialties. So in this year alone, we are streamlining not just community health workers training, but community health worker nurses, biomedical technicians, pharmacists. So in all the related fields you can think about, we have been working on expanding the training and seeking out collaboration so that we can improve the quality of training that we're offering.
So glad to have you on the program. Time is running out. I'm quite sure we would like to bring you back during the first quarter of 2022 for you to tell us plans, but and then the budget will be out, and we will to get you to indulge some more in what's in store for us for 2022. Thank you for being on our program. This is Health Matters. Thank you for being with us. I am Nazim Hussain. Do join us again next time, and until that time, please stay safe.